Hello, everyone. I am Dr. Andrew Neville, and this is our Facebook and YouTube live Q&A to address anything and everything that is adrenal fatigue. We like to do these Q&A sessions to be able to talk about what adrenal fatigue is, what adrenal fatigue isn't, and try to address any of the misinformation that's out there. Because absolutely there's a lot of misunderstanding out there, and that's what we're trying to address. To be able to catch people as soon as possible in their process, in their kind of health or healing journey with regard to this condition. That's the important part. On a pretty regular basis, daily basis, I field new patients come into me with, and I hear their stories, and their stories are difficult. They're all different, those stories, for sure. But they have all come to a place where, because of a combination of kind of genetics and kind of enough stress over time, they have developed adrenal fatigue. And what they've come to realize is that adrenal fatigue is absolutely debilitating. And I've been there, and I know that. And I've seen it, right, every day. And the key is that people aren't getting the help they need because they're being misguided by people unintentionally. Most people have good intentions, right? But it's all about that misinformation. So what I'm looking for now is a heads up from my crew that everything's looking okay. Looks like Facebook looks okay. Somebody's going to tell me about YouTube. I trust. I've got the best team around, so they'll let me know if everything's good there. And what I'm going to do is pull up my document with regard to that has all those questions that everybody's been sharing, which I appreciate. So before I jump into that, by all means, click the like button, subscribe to us, comment and question, live. I've got, my coaches are manning kind of the chat boxes, right? So they will be able to address questions or send questions to me so that we can, kind of get those questions answered, right? Get you kind of the right information. That's really the key. And if there's anybody that, you think is would benefit from this information, by all means, share and get that information out there. That is really the key. Let's see. So, how we doing on YouTube, crew? Looks good. Okay. Let's get started. I've got a big list of questions. Some of them are carryovers from last time, which I apologize for. By all means, keep the questions coming in. We will get to as many as we possibly can, and we'll go from there. Let's get started. Okay, so Linda asked a question: is hypoglycemia and adrenal fatigue related in any way? And is it possible to get out of the hypoglycemia rut? Okay, Linda, the answer is 100%. In fact, there's no other reason really for your hypoglycemia and this issue that you're dealing with. The main reason I can very easily say that is because it's your adrenal's job to raise your blood sugar if ever it drops. Right? So if your blood sugar drops, right? Like if you were to skip a meal for some reason, or even if some well-intentioned practitioner said, hey, you should do intermittent fasting, get that weight off, right? Which means you're not eating for a big chunk of time. No matter what the reason is, if you miss a meal, that's dangerous, right? And the body knows that. It's got to keep your blood sugar in a certain window. You don't want it too high, but you definitely don't want it too low because you'll slip into a hypoglycemic episode of some sort. And I've seen some pretty severe ones in my practice. So what happens? Blood sugar drops. The adrenals get stimulated down the HPA axis. Again, this is not just an adrenal problem, but a problem with that whole, well, I'll talk more about it. It's really a stress response, system dysfunction. So anyway, the adrenals are stimulated. They have to release cortisol. Cortisol's main job, go to the liver, tell the liver to release a stored form of sugar into the blood so you don't go passing out from hypoglycemia. And now what it is, technically, by the letter of the medical law, What you have, what all my patients have, is reactive hypoglycemia, not true hypoglycemia. True hypoglycemia is actually a liver disorder. It's incredibly rare, but that's what doctors look for. Oh, you don't have hypoglycemia. This reactive hypoglycemia, they don't really pay for or pay any attention to. Anybody who has adrenal fatigue or even suspects they have adrenal fatigue needs to eat what we refer to as a hypoglycemic diet. So a hypoglycemic diet, and I've talked a bunch about this on YouTube. So if you kick over to my YouTube channel, I've talked about this, how we should eat with regard to this, at least, little blurbs. I mean, people need some help with regard to diet and how this works. But a hypoglycemic diet simply is small, frequent meals, more protein and fat, low sugar and carb. That's the biggest thing. Make sure you stabilize that blood sugar. That helps, right? Because now it's less work for the adrenals to do, right? So there's less stimulus on the adrenals. And the problem is these adrenals, they're overstimulated, right? Because of stress physiology, because of various stressors in our lives, you name it. Your stress is better than I do because of, it could be inflammation, it could be a virus, it could be, kind of an injury, it could be a stressful thought or event or whatever that triggers the adrenals. So what we have to do is try not to trigger the adrenals so we can heal. One controllable stressor, right? Because not all stresses we can control. One of those controllable stressors is our blood sugar. So if you can eat in a way that prevents your blood sugar from dropping, that's a big stress you can scoop out of that bucket. Big stress. So anybody with adrenal fatigue needs to eat this hypoglycemic diet. I will emphasize snack before bed is included in the hypoglycemic diet because everybody's blood sugar drops overnight. Everybody, right? You go from dinner to breakfast, it's like 12 hours, right? Well, your blood sugar is going to drop 3, 4, 5 hours. Well, for most people, that's a minor stress. They generate a minor response, fix the blood sugar, no problem, right? Sleep right through it. My patients, our stress response system has been overworked so much it is sensitized, which means it's trigger happy, which means we make mountains out of molehills. So blood sugar drops at night, minor stress, major response. Now we could be wide awake in the middle of the night just because our blood sugar dropped, right? So this can help us sleep as well. So key thing to do when you have adrenal fatigue is to deal with the blood sugar. So the second part of your question is it possible to get out of this hypoglycemia rut? Yes, absolutely. Fix the adrenal problem. When your adrenals are happy and healthy and balanced, they manage your blood sugar. You might find it kind of strange to think about this, but most people don't have to micromanage their food intake. Their adrenals can do it. If they skip a meal for some reason, their adrenals take care of the blood sugar. No big deal. Just eat the next meal. For my patients, it's like, it's like a tiger just jumped out at us just because our blood sugar dropped. You heal this system, heal the adrenal issues, and you don't have to worry about that anymore. Now, question is, right? How do I heal the adrenals, doc? You got to know what you're dealing with. And this is one of the biggest problems that's out there is this incredible misinformation about adrenal fatigue out there. The problem with the adrenals is not just the adrenals, because the adrenals don't work in a vacuum. They don't decide whether or not to release cortisol and adrenaline and all those other hormones. There is a bigger system that the adrenals belong to that becomes dysfunctional, which ends up in adrenal problems, right? The most accurate name to call this condition is actually a stress response system dysfunction, which admittedly is not a great name either, but we have no other good name for it. So we call it adrenal fatigue. It's really a stress response system dysfunction, which means your whole stress response system is problematic, which ends up in your adrenals being kind of whipped like a tired horse, right? And then in the beginning, there's high cortisol. In the later stages, there's low cortisol. All that stuff happens. So to fix it, and you can fix it. You can. I had it myself. Had it, right? And I've worked with hundreds, thousands, right? Several thousand patients over 20 years in doing this to get people back on their feet when you address it in a more holistic way, not just, can't just take a little vitamin C, a little ginseng or whatever and fix this. You got to tackle that whole system. And what you have to realize is that everybody is a little bit different, right? And the guidance that everybody needs is a little bit different. Their problems are a little bit different. You want to test it, you want to assess it. There's no kind of cookie cutter approach for this thing. I've learned that, right? Just because I got better, that doesn't mean, oh, I'll just tell you to do what I did and you'll get better. It doesn't work. It just absolutely doesn't work. So you absolutely can get out of the hypoglycemia rut, fix the adrenal problems. Takes a little time, takes a little effort on both our parts, right? A little expertise, but you absolutely can do it. Okay. So by now my crew is giving me the hook and saying, okay, too long-winded of an answer. Dr. Neville, speed it up. My apologies. I give them work. Angie says, if someone is dealing with several high cortisol points per saliva test, will this always advance into low cortisol? It can't be healed before going low. I feel like I've been stuck in fight or flight for about 7 months or so. Okay. I can appreciate that, Angie. Being stuck in fight or flight is probably the most miserable and uncomfortable phase of this condition. I was there. Fight or flight is designed for saving you from a tiger, right? So that adrenaline, that cortisol, it drives the fear, right? It drives the worry. And that makes sense, right? I mean, in kind of evolutionary biology, like the more, when you dump adrenaline and cortisol, it stimulates fear. The more you fear the lion, the better your chance of getting out of there, right? You're going to detect it and be like, all right, I'm out. But it's miserable. I've been with it. So what does fight or flight do, right? Fight or flight contributes to anxiety, insomnia, right? All the wiredness, the trembling, the tingles, the easy overwhelm, all that stuff comes from cortisol. Many of my patients are diagnosed with what we now consider psychiatric diseases, right? Oh, you have anxiety, right? You have depression. Are those a thing? Of course there's a thing. My work is to try to fix the underlying cause of what those conditions may be, right? Because to me, the vast majority of the time, those conditions, which are official conditions, they are symptoms of an underlying problem. And that underlying problem is your body is stuck in fight or flight, right? You throw a bunch of adrenaline in somebody's brain, you're going to see anxiety. You fix that, and now you can't diagnose that person with anxiety anymore. I've seen it. So it's not purely, it's not purely a psychological problem. Can our psychology make that stuff worse? Of course, right? If you're worried about stuff that it maybe is out of your control, right? Or if you've got, certain tendencies, yes, we can make that worse. But when you balance this underlying physiology, and hopefully you guys have seen me do this a little bit, right? This is the balance between fight or flight and rest and digest. When you get somebody out of fight or flight and turn on rest and digest, what we will see, right? What we will see is that anxiety, the wiredness, the palpitations, the swell, all that stuff kind of little by little goes away. So just because you have high cortisol, does that mean it'll always exhaust itself and go to low cortisol? No. And while I know it's crazy and uncomfortable to be in fight or flight for 7 months, I've had people in fight or flight for 7 years, if not longer, right? And you can get to it. You can absolutely get to it. You can get people out of that fight or flight stage, right? Will it always deplete? Let's say everything stays the same and you're just stuck here in fight or flight. It won't always. I mean, I've seen some people be stuck in fight or flight, decades, right? They've been in the earlier stages of adrenal fatigue, which is high cortisol levels. At some point, though, the vast majority, the supply can't keep up with the demand. Right? Picture a zebra in the wild trying to run from this lion. Right? I mean, how long is that chase going to last? Right? 30 seconds, maybe a minute. And that zebra will be thoroughly exhausted. I mean, it'll have to go curl up under a tree for a day to heal and repair. Right? We haven't been running from that lion or tiger, depends on the continent you're on, but we haven't been running from that lion for 30 seconds or a minute. I mean, it's more like, I don't know, 30 days, 30 years for some of us, right? I mean, it's debilitating. Eventually, supply can't keep up with the demand, and absolutely you can put so much pressure on your adrenals that they have problems creating enough stress hormone, cortisol, DHEA, and some others. And this is where conventional medicine will say, nope, adrenal fatigue doesn't exist. It's not a thing. It's not a thing. That's what they're taught. And I'm well aware of that. Now, nothing could be further from the truth, but that's what they're taught. They're taught that if your adrenals haven't completely failed, which is a very rare condition called Addison's disease, complete failure. It happens, but it is incredibly rare. If you don't have complete failure of your adrenals, you can't have an adrenal problem. That's what they're taught. That doesn't even make logical sense if I think this through a little bit. Let's look at the rest of your endocrine system, right? You're allowed to have a thyroid hormone problem short of complete failure. You're allowed to have an ovarian hormone problem short of complete failure, but not your adrenals. If your adrenals are functioning at all, they're great. Doesn't make sense. Now, even if you look into the research or you look at, I don't know, the thousands of tests I've done on patients, you can see the staging as people go through this. Even though they're in a stress response, they should be dumping a bunch of cortisol and they can't. Will it always happen? No. Is it likely? Yes. The key in treatment, Angie, the key in treatment is get your body out of fight or flight. It's not just an adrenal problem. You got to hit it from a variety of angles because it's that whole stress response that is keeping you there. Okay. So you got to work at this in a comprehensive way. And, you know, most of us just need guidance with regard to that. But yeah, I mean, that's what you need to do. So if that's what you're thinking about, I mean, that's exactly what you need to do. Now, good thing is you got to test, right? And you got to test. The best way to test for adrenal problems is salivary cortisol tests. A couple caveats. I've seen that testing misinterpreted numerous times, which means patients don't get the care they need until, you know, years later they come back and I'm like, well, what about this back then? It's frustrating. I've also seen those tests interpreted the right way, but doctors not really knowing exactly what they're looking at, right? So if we leave conventional medicine because they don't believe adrenal fatigue is a thing, even if you look at the symptoms of adrenal fatigue, compare them to adrenal failure, they're the same, not as life-threatening, but they're the same, and they're certainly debilitating for sure. Okay, so if we leave conventional medicine, we go to alternative medicine, you'll find doctors that believe in adrenal fatigue, they test for it, maybe even find it. But what I've discovered is they've just kind of grabbed hold of a tail of something that's way bigger than they anticipated. And I say that because the adrenals, again, they're part of this bigger system. It's all the hormones in your stress response, including the adrenals. It's the autonomic nervous system, which is over here. They work together. And it's the limbic system in the brain, which is the CEO calling the shots. To get ahead of this, you got to deal with all of that together. And I know that sounds like more, right? Or complicated or whatever. And it kind of is, right? But we've been doing this a long time, right? So if that is complicated, I like things to be understandable. And like, that's why I put all the videos on my YouTube channel, condition videos. Like, what about this symptom? Is it associated? It's probably on that YouTube channel, right? So go to that. And especially my mini course, right? My mini course that's on my YouTube channel is great. I mean, it's me kind of explaining some of the ins and outs of this and what it actually is. And once you know what it is, this is my hope. Once you know what it is, you can treat it. Now, we're pretty good at treating it for sure. And I've got patient coordinators who are there doing complimentary calls for patients, which I would encourage anybody to go get that complimentary call. Talk to one of my patient coordinators. They've been through this. They know they're the most compassionate, understanding people. And they can talk to you about kind of options moving forward. I still have spots for new patients within the program that I developed for this condition. So you can get help. You got to know what you're dealing with first. Okay, Melissa says, is it possible to heal and to carry a full-term pregnancy after adrenal fatigue? In the last year, I had 2 miscarriages 6 months apart, diagnosed with Lyme after the first, Epstein-Barr recently. I feel I'm in mid to late stage adrenal fatigue, working to heal. I had seen an endocrinologist today, and they will not help me. I left even more frustrated. Okay, Melissa, sorry to hear about your experience with the endocrinologist. That is so incredibly common, that story. I even prep my patients sometimes if they come to me first and they're like, oh yeah, I got an appointment with your endocrinologist. I'm like, here's what's going to happen, right? They're going to do a simple blood test. They're going to rule out adrenal failure and Addison's disease. And once they do that, they're going to kind of ignore your symptoms. They're probably not going to see much of anything else show up on blood work. And you end up probably getting a prescription to either some specialists or eventually the psychiatrist, because if I can't find anything, it must be all in your head, right? Ridiculous. None of that is true. So walk away and don't be disappointed. They only know what they know. It's just a little limited. Now, I'm also sorry for your loss with your miscarriages. Been through that. My wife and I ourselves have been through a miscarriage. And what I can tell you is my son was born after that and after the adrenal fatigue that we worked on and all these issues that were underlying some of that stuff. Now, that was before I was a little better at this. That was all way back in med school and all that stuff. So the answer to your question is 100%. You can get pregnant. You can carry to term after or as you heal from adrenal fatigue. You can. But I would suggest that to be able to get pregnant and to carry full term, you do need to heal your adrenal fatigue. And here's the main, there's lots of reasons as to why adrenal issues will mess with your reproductive hormones. The biggest one is, if we can picture your adrenal fatigue is basically you in a stress response. That's what happens, right? We kind of get stuck in a stress response. It's pretty predictable what happens when our body is in a stress response. We are activating certain organs that would save our life, okay, via all the hormones and the nerves. We're activating organs like your heart and your lungs and some sugar metabolism, right? Because you must need fuel to fight this tiger. Can't wait to eat lunch and get fuel, right? So here's a bunch of sugar. So we turn on those organs, and then we turn off a bunch of other stuff that's really non-essential if there's actually a tiger in front of you. Don't waste energy here. Like, deal with the threat, and then let's shift back. Problem is we don't shift back, right? So there's 4 main organs that get suppressed when our body is fighting a tiger. Immune, digestive, reproductive, thyroid. And we know that. That is in conventional physiology. That is a fact. We all know that. We're all taught that. Even conventional doctors are taught that. But that's kind of a deeper level, right? So what happens, right? You're fighting a tiger. You want to suppress your immune system, right? Don't waste energy fighting some chronic infection, right? Lyme, Epstein-Barr, those are, well, I'll talk about that in a second. So don't waste energy fighting a chronic infection. Don't worry about that inflammatory response. Forget about that. Conserve that energy. Deal with the threat. Same thing with the gut. Shut it down. Don't waste energy digesting, absorbing. Don't really want you to have a bowel movement right now. There's a tiger, right? You'll be lunch. We also know that excess stress hormone, or stress hormone in general, goes to the hypothalamic pituitary ovarian hormone axis, testicular hormone axis for guys. That happens too. And it suppresses them on purpose. on purpose, right? There's a tiger in front of you. We don't care about your periods. We don't care about your sex life. We actually don't want you to procreate right now because now both of you we shut all that down. Same thing happens with the thyroid. And there's others too, right? Detoxification gets shut down. I mean, there's a bunch of other stuff that gets shut down when we're in stress physiology. That is what we have to fix. I've had so many patients, female patients, have fertility issues because of this condition. So they go down the OBGYN, reproductive endocrinologist, right? And they go down this road doing some pretty heavy medications, hormones, whatever it is, to try to force the ovaries back on, right? Trying to fix those systems while your body is purposely suppressing them. I mean, it's like trying to push a car that has the parking brake engaged. I mean, you get enough behind it, you'll get her to go a little bit, but it's a whole lot easier to release that brake and shift that physiology, right? That's what needs to happen. I mean, I've got a woman in my practice right now. Her baby's 6 months old, right? We've been working on this for, maybe a little more than that, 6-9 months. It takes a little time, but it absolutely can happen. Now, you also mentioned the Lyme and the Epstein-Barr. These are, again, secondary or tertiary issues, right? To me, we all have this one stress response system, right? The hormone side, the nerve side, the limbic system in the brain calling the shots, right? That system has to deal with any and all stress, which means it's kind of like a bucket, right? We all have a certain size bucket of tolerance for stress, some big, some small. It's genetics, right? Half from mom, half from dad. There's your bucket. I mean, you can overwhelm anybody's bucket if you throw enough at them. This bucket was not designed for the stress we have today. This bucket was designed for old school stress, hardship, right? Give me a good old fashioned famine, plague, predator jumps at us, right? That bucket would fill up all at once. We jump into fight or flight, deal with it, hopefully. Then if we live, bucket drains, shift back, shift out of fight or flight, right? Turn off the wear and tear. It comes from fight or flight. Turn on the healing and repair. Live to fight another day. We don't have stress like that, most of us these days, right? We start filling up this bucket from a very early age. Any and all stress, physical, mental, emotional, spiritual, social stress, diet and nutrition, toxins, accidents, bad infections or surgeries or injuries, especially head injuries can predispose here. Past trauma, abuse, and relationships and finances and jobs and school and family and politics and social media and Lyme and Epstein, like it all is in the same bucket, right? And it's as that bucket fills up, that's when our physiology shifts. It's very seductive to try to chase after the stuff that's in the bucket and say, oh, you've got Lyme, that's the cause of all your problems. But Lyme is only this much in your bucket. The challenge with that is we've all seen these stories on the web where it's your mercury toxicity, right? So people go and there's a story about a person who got their fillings removed and they detoxed and all that stuff and they got better and they never had a problem ever again. I've never seen that person in my practice, but my suspicion is that person was somebody whose bucket was like half full with mercury. They fixed that and everything got better. Most of the time, in fact, the vast majority of the time, that's not it. Mercury is here, right? So is whatever. These viruses are everywhere. Epstein-Barr, Lyme, CMV, parvovirus, mycoplasma, enterobacter, H. pylori, candida. We've been chasing after the bug for this condition like forever. It's not the bug. It's not the bug. My Epstein-Barr, your Epstein-Barr probably reactivated. So did mine, right? Numerous times until I finally figured it out, right? It's the Epstein-Barr reactivates. Epstein-Barr is an opportunistic, right? It's an opportunistic infection where, because everybody's got Epstein-Barr, right? 95% of the country is going to test positive for having Epstein-Barr, but it's the same virus in everybody. Why does it not cause these problems in everybody? Right? So the problem is not the virus. The problem is us. Me too. Was. Meaning, why can't my immune system keep Epstein-Barr dormant just like everybody else does? Well, what controls your immune system? Largely this. This is the main control knob that we have on the immune system. It's very predictable what happens to the immune system when we're in stress physiology. It shifts, makes us vulnerable to chronic infections, and then it's pro-inflammatory. It causes allergies, antibodies, asthma, autoimmune, all that kind of stuff. That's what we have to fix. Okay, another long way. I don't know if I'll learn. Sorry, guys. D says, my doctor tested my thyroid, my hormones, and everything was in limits per him for a perimenopausal woman. So I just deal with the symptoms. Weight gain, fatigue, hair loss, low vitamin D. Okay, so, pardon me. Low vitamin D is not necessarily assessed, although you don't want low vitamin D. The whole country is pretty much low in vitamin D. Now that we started testing it, we're just too high north of kind of the equator, right, to be able to use enough sun to convert cholesterol into vitamin D. Plus, we slather ourselves up. Even if we're out in the sun, we slather ourselves up and we block that process. Anyway, most of us are low in vitamin D. Low vitamin D isn't causing your adrenal problems, but the low vitamin D doesn't make it any easier to heal, right? So you do want to optimize your vitamin D because that speeds up the healing process. Optimal vitamin D, again, you're looking at their ranges, right? Their ranges on vitamin D is like 30 to 100. Optimal, with regard to most alternative functional doctors, 60 to 80. And I do try to get people their vitamin D up to 60 to 80. So take as much vitamin D as does that. It's not 1,000, probably 5,000, maybe even more. Okay. Now, so let's talk about D, your hormones, your thyroid, and all that stuff. When these doctors run their testing, conventional medicine is trying to rule out things that can kill you, right? Their testing for thyroid is like, frank hypothyroidism or cancer, right? That's kind of what they're looking for. You actually want those tests to be normal. And I know it's frustrating to have like all these symptoms, yet all my tests keep coming back normal. I get that is very frustrating. I really do. But again, they're trying to rule out, it's what that model is designed to do, rule out stuff that is very dangerous that can kill you, right? We do kidney function tests, liver function tests. Pretty much they rule out failure. You can have plenty of problems within your liver, your kidneys, your thyroid, right? Your ovaries that don't show up yet on blood work. So sometimes you have to read between the lines. With regard to thyroid testing, most of the time they're just going to run a TSH. TSH is a pituitary hormone that triggers your thyroid to release hormone. Most of the time that's normal. What you also want to do, you do want to do more comprehensive testing. When you look at the thyroid, you want to also test for your thyroid hormones, T4, T3, free T4, free T3. And there's even some other tests, right? So you want to do a comprehensive test. However, even if you had a problem with your thyroid, you've got to deal with the adrenal issues first. When I was in med school and coming out soon thereafter, I used to view our endocrine system, it's primarily your adrenals, your ovaries, and your thyroid, kind of like a three-legged stool because they all talk to each other. I mean, it's kind of confusing and interesting, right? But they all talk to each other. So it's a three-legged stool. I was wrong. It's not a three-legged stool because the adrenals are the main driver of where the rest of those glands go, right? Because like I said, when you're in fight or flight, you're going to suppress ovarian hormone function, thyroid hormone function. That doctor you went to, they don't believe in adrenal fatigue, so they don't even look for it. Oh, well, let's do a cortisol. Do you have any cortisol? Okay, you're okay. Now, perimenopause, it's ridiculous, right? I try to laugh because otherwise I will scream and cry because it's that annoying. Perimenopause is an interesting time. What we know is that, interestingly, your adrenals actually produce every ovarian hormone you have. And sadly, I didn't learn that in med school. Most doctors don't, but they do. So the adrenals produce Progesterone, testosterone, actually most of your progesterone, your whole life, most is coming from your adrenals. Progesterone, testosterone, and some estrogen. And that offers some fine tuning to ovarian hormone production during childbearing years. It's most important in and around perimenopause, menopause, when the ovaries are gradually going to decline in function. That is a normal, natural process. That is not a disease in and of itself. But what we know at that same time is that the adrenals start to increase their production of those ovarian hormones. And what that does is that eases a woman through menopause without a symptom. In fact, postmenopausally, the majority of your ovarian hormones, they're coming from your adrenals, not your ovaries. So the adrenals come in and save the day if they haven't been kind of beat up with, many years, if not decades of stress and activity and, who knows, all that stuff in the bucket over time. So whenever a woman talks to me about perimenopause, menopausal symptoms, that's an adrenal problem. I'm always going back to that. Guaranteed, if we tested your adrenals, they would be off, because the adrenals also cause fatigue, pain, weight, brain fog, insomnia, anxiety, depression, blood sugar problems, blood pressure problems. I mean, it's pretty typical what you see when your body is dealing with stress hormone, excess stress hormone over time, right? That is what has to be fixed. So you do not have to just deal with your symptoms. What you got to do is get a proper assessment, right? A proper assessment, have a conversation, get tested, and treat this. I wish it was as easy as, okay, I have these symptoms. Can I just take something? Can you just give me an herb for this, or just a vitamin or whatever? It's not that easy. It's not. And anybody that tells you that that's the case, they're not being honest. It just doesn't work that way. If there was a vitamin or a drug or an herb that could fix this, you would have found it already. You would have found it. It doesn't exist. Now, that's not that I don't use those things in my practice. I mean, there's some stuff that's broken. I do have to use vitamins and herbs and minerals you got to fix depletion. You got to correct antioxidant status. You got to repair mitochondria. You got to tweak hormones. Like, there's a lot we have to do. So I use those things. But there's not any one of those that's going to fix all this, right? To me, using kind of the supplements and vitamins and things like that, it's like we're going to repair a house, right? So we got this house, we go to the job site, you got to deliver all the stuff, all the tools and the equipment and the supplies and lumber and all that stuff. Get all that stuff to the job site, right? That's all your vitamins, minerals, supplements, all that stuff, right? But what if the crew doesn't show up? Not much happens, right? Nothing happens. In fact, the way we tell the crew to show up to be able to utilize all that stuff is we have got to shift this physiology, right? Get somebody out of a stress physiology into rest and digest, which is where we turn off the wear and tear that we're causing in the body. We turn on the healing and repair. That's when you can use all that stuff. And that's when you can really kind of get back on your feet again in a consistent way, because you can. We all can. The body knows how to heal itself. But guess what? That physiology is not turned on when we're here. It's just not. Whether it's physiology, biochemistry, even the genetics of healing and repair, you're turning that stuff off when you're in fight or flight. We've got to be able to shift this physiology. And there's a lot to it. I mean, it takes a little work to do it, but it can be done. Okay. So D says, how we doing? 20 minutes. Okay. D says, I read that as a woman, you need to be careful with the intensity of workouts because it releases cortisol too. Is that true? Not just as a woman, but also as men. Exercise is a stress on the body. It's a good stress, right? It's a good stress. You want to stress the muscles. You want to stress the heart, break them down. They build back stronger, better, right? However, if I've got somebody who their bucket is full and I add any stress, even a good stress, it can become problematic. Plus, and I don't want to get too far into the weeds here, but Stress physiology over time damages your mitochondria in your cells. It's the mitochondria that produce energy for the body. They take you back to your high school biochemistry or biology, right? Mitochondria take energy from food, turn it into a universal form of energy called ATP that we could use to do stuff. Anything. Move a muscle, think a thought, build a neurotransmitter. It all requires mitochondria. Well, the mitochondria are highly susceptible to the oxidative stress of stress physiology. They are damaged, and they lose their ability to produce energy efficiently, right? Nutrients in, waste products out, all that kind of stuff doesn't happen. So, yes, the intensity of workouts, but it's also the duration of workouts has to be shortened as well. So vast majority of the time, I am kind of backing my patients off of exercise because it's a stress, it's a demand. You're spending energy on exercise. Now, I'm not against exercise. Some of my patients might think that because I have to slow everybody down. I'm not against exercise. I want all patients to move as much as they can, just not more. And that's a fine line to walk. So I tell my patients, look, the more you exercise now, the slower you're going to heal. I know that's weird, but that's the reality with this condition. This condition is unlike any other condition, and healing from it, this is one of the biggest challenges. Healing from this condition is also unlike anything else because it is incremental. It's incremental, it's up and down, it's incremental, but, and you have to put, we kind of have to put, everybody's got this therapeutic puzzle with regard to treatment for this condition. And that's what we have to figure out. What does that puzzle look like? Now, everybody's got the same physiology, right? Or structurally, right? We got the hormones, the nerves, the limbic system, and the brain. So some of the pieces of that puzzle, it's consistent among humans. But beyond that, the puzzle kind of diverges. And this is the challenge with this. The only way I've learned how to figure out what that puzzle is for each individual person is with frequency of contact with patients. And I used to have patients come and stay with me. They would stay at our guest house here on our property from all over the country, a couple weeks, couple months even. Now, by the time I would send them home, they're already feeling better. Now, you don't fix this. You don't fix this in 8 weeks, right? That's not going to happen. But they are shifting, okay? So they are shifting. And they feel that shift, right? And by the time they leave, they've got a plan, they've got an understanding of the plan, and they got tools to implement the plan. So not only they feel better quicker, but they would stay better longer. And to me, that's what healing is all about. Straight up. Understand what you're dealing with, get ahead of it, know how to manage it, and go live your life. Stay away from as many doctors as you can, including me. Now, the challenge with that is most people don't have the resources to come to our facility and make that happen. So a while back, I started working on a program hoping that I could duplicate those more successful outcomes those patients had, but so people wouldn't have to come here to make that happen. And that's turned into this kind of all access program that I've developed. And I do that for the vast majority of my patients. I mean, it works better than anything I've ever done, but it's still work. It's still work and it still takes time. And if anybody has any questions about that, please just reach out. I've got patient coordinators who can talk to you about those options. Okay. So Angela says, what type of exercise is good for this diagnosis of adrenal fatigue? I think somebody just said, what are we talking about? We're talking about adrenal fatigue, which is terribly understood. What type of exercise is good for this diagnosis? Yoga and stretching? Sure. Yoga stretching is okay. When I add exercise and movement back in, I tend to call it movement. And I tell patients, all right, just flop around on the floor a little bit, right? Stretch a little bit, a little light yoga or whatever. And then we listen to your body. We see how you feel. And then we just kind of incrementally, slowly kind of add that stuff back in. People can go for a walk. I like people to get outside. That's more for nature than it is for like the purpose of exercise, right? So that's kind of the issue with exercise. So you can do some, but again, the more you push exercise, the slower you heal, because you're draining, you're using up that energy, right? We want to use we've used up energy, right? We use up all this energy fighting tigers, right? So, we want to kind of back off of that. Okay, Tashina says, put on an antidepressant before finding out adrenal fatigue. Do you have any supplements you can suggest that can help with the weaning process, weaning off with the supervision of a doctor, but would like to have some options to process? Okay, so yeah, I can't give you kind of specifics with regard to this, Tashina. Most of my patients are treated, right, where their doctors will kind of put Band-Aids over these things, like take this for your depression, take this for your anxiety, without any attention to the underlying problems. Now, here's the way I view those things. They are crutches. And that it is fine to have crutches, right? It is absolutely fine. We need crutches sometimes. That is not a derogatory comment, but you cannot kick crutches out from underneath people unless you fix the underlying problem first, unless you supported them in some other way first. That's the key. That's really the key. And support meaning not just, oh, you're on an SSRI, just take some 5-HTP or tryptophan. That'll support you when you wean off of the SSRI, which is all about serotonin. It's not that simple. In order to successfully get off these medications, you have to fix this underlying problem first, which I'm describing to you. You fix that, and you're not going to need any fancy supplements. You don't need the supplement because you don't have the symptom anymore, because you fixed the underlying cause of the symptom, right? So that's really where the focus has to be. Okay. Okay, so I want to address, Amy's got a question here that I saw just show up. Amy says, what if Lyme is what caused all your symptoms and the adrenals are merely trying to keep up? Wouldn't you need to go after that root cause? I guess the real question is, how do you know what the root cause is? It's a great question, Amy. It's a great question. And I think about the nature of these viruses, right? And what I would encourage you to do is look at your physiology, look at what adrenal fatigue is. And my question would be is, did you have any pre-existing symptoms prior to getting hit with the Lyme, whatever the Lyme is, right? Now, some people get Lyme, they get acute Lyme, they get a rash. Many don't get a rash. And they very rarely will they say, okay, it was the Lyme, and ever since then, I've had problems. Other people will say, well, you have chronic Lyme, meaning we don't know when it started, right? Which now they attach all the symptoms that are actually adrenal symptoms. They start attaching all that to Lyme. And this is a challenging conceptual thing that I run into all the time. Here's my question. Lyme is Lyme is Lyme. It's the same bacteria. It's an annoying bacteria and it's an annoying infection, but it's like Epstein-Barr or CMV or other herpes family viruses. These viruses are ubiquitous. Why is it a problem in you and not your neighbor? Why does my Epstein-Barr reactivate and not my neighbor? The problem is not the virus or the bacteria. The problem is us, right? Us. So it's our immune system. And again, the number one control volume knob of the immune system is your stress physiology. Predictably, stress physiology suppresses the immune system and causes these problems, right? And it causes this vulnerability to those infections. And I get it. I know that's a different way to think. I mean, I would attend, still do these, the major chronic fatigue syndrome, fibromyalgia conferences every 2 years. International Association of CFSME. They've got these major conferences, and they present all these PhDs present. They have been trying to pin those conditions on a bug, on a germ, for decades since I've been going. Some specialize in Lyme. Look, we find all this Lyme. Okay, yeah, but what about the mycoplasma? What about the Epstein-Barr? What about the CMV? What about the parvovirus? What about the enterovirus? So all these experts are focusing on their one virus. They're all a problem, but they're all missing The underlying problem being their immune system is vulnerable. It's not clearing those infections. Why? Stress physiology over time. If you look at the symptoms of adrenal fatigue, I can all but guarantee that you will see signs and symptoms of these before you got hit with the Lyme. Mark Twain famously quoted, one of my favorite quotes is, "It's not what we know for sure. No. It's not what we don't know that gets us in trouble. It's what we know for sure that just ain't so." Challenge what you know for sure. Challenge those beliefs. Just think, oh, well, could it be some other issue? I know doctors try to pin, they say, oh, well, what's causing your adrenal fatigue, right? It's what's in this bucket to a degree. Genetics plus what's in the bucket. Lyme is like this. But there's also Epstein-Barr, there's a divorce, there's a death, there's a being type A, being caring too much, being a little more sensitive, trauma, abuse. That bucket is layer upon layer upon layer upon layer upon layer. It's easy to chase after that stuff. And people feel a little better, but they never fully get ahead of it. I've seen it time and time again. So challenge those thoughts. Okay. Cheryl says, after I lost my daughter, my adrenals started misfunctioning. 6 more losses in 9 years. Breast cancer surgery, COVID sent me into major adrenal insufficiency. That's a good reason for it. I was put on low-dose hydrocortisone, T3, MP thyroid. Want to heal the cause, not symptomatic. What's the first step to healing the cause? All right. So, Cheryl, I'm sorry for your losses first and foremost. Certainly those are significant stressors, of course, right? And it's not that we're like supposed to be meant to live a life that's stress-free. Don't hear that. It's just when the stress is enough to kind of overwhelm this system. And you've got, I would put every one of those in there, right? Death, other deaths, breast cancer, surgery, fear of breast cancer, worry about breast cancer. COVID is in there too. We've all talked about long COVID now, which is really adrenal fatigue. I've written on that, so I can't get into it now, but or maybe even did a video on that, so go to YouTube. What you experienced was going to a practitioner who just thinks you can just replace hormone and fix these problems. I'm not a fan of using hydrocortisone to treat patients, straight up. I've seen thousands of patients with this condition. It's extremely rare that I've ever had to refer somebody to try and use hydrocortisone, which is based, just for everybody else, which is basically a mimic of cortisol, right? The reason is that you get suppression, right? Whenever you use a hormone, you are going to suppress the gland that is actually producing that hormone, even with low doses. And you can look at the research. I know some doctors say, oh, no, you don't get it with that. Well, show me the research that shows that, because you do. What's more important is what you end up doing is losing the dynamic responsiveness of your adrenals. Your adrenals are the most dynamic, fluid endocrine gland in your system. They're constantly moving, changing output, meaning, so the easiest way to look at it is your circadian rhythm, right? Defined by cortisol. High in the morning, then it gradually goes down. But within that day, there are 300 to 500 microsurges of cortisol in and out throughout that day, because your body's always using this to respond. Is the blood sugar low? Did the barometric pressure change? Did he just stand up and now I need to release stress hormone? Like all that stuff doesn't happen because you're taking this static dose of this hormone. Now it's life-saving if you needed it. Life-saving. And I don't know your situation, maybe. But I've seen so many kind of inexperienced doctors say, hey, your cortisol's low. Let's just put you on cortisol. That'll work. And then people feel a little better. And you will. If you have no cortisol and you add cortisol, you're going to feel better. But what you're doing is you're not healing any of that system. So to heal this, to fully heal it, you got to look way beyond just the adrenals. Look at the rest of that stress response system. What is the first step? Go to my YouTube channel or call us. my YouTube channel, start with the Minicourse. Find out what this adrenal problem, what it actually is, because it's way bigger than just the adrenals. And what I would also do, again, if you're on all these hormones, your situation is significant, and I would recommend you need expert care. So I'd reach out. I'd reach out to us, get a free consultation. You can talk to one of my patient coordinators. They can guide you and figure out if there's a fit there. Because you can still fix it. I mean, I've had plenty of patients on cortisol, hydrocortisone, that we've been able to get off over time. It takes time. You got to do some work to fix everything else. But then we want to kind of gradually wean people off. But there's way more to it than what I can address right here. I apologize for that. Okay, good luck. It's frustrating. It's frustrating. And most of these practitioners are well-intentioned. They really are. They're doing the best they can with what they know. I just know different stuff, right? My experience is different, right? That's just the situation. Tamara says, do you like using NAC type products to help produce ATP while rebuilding the adrenals along with stress reduction, et cetera, lifestyle changes? Thanks. I don't mind NAC. I know about the research in NAC. Just for everybody else, NAC is N-acetylcysteine, which has some research in a variety of things. When I try to fix ATP, which is this universal form of energy, we're going to mitochondrial function. There are different things that I will use. And again, I don't find any one supplement is magical. One of my favorites is actually resveratrol, which is a good kind of way to support this. So while I don't use NAC and patients get better, I could see the reasoning behind using it. But I could see there's reasoning behind using. I mean, there's numerous things, right, that you can look at, right, that we go, oh, well, I should take that. And a lot of my patients do that, right? It's like by the time they come into me, I have literally had, this is one that sticks out in my mind. I had a woman come in and she had a suitcase full of stuff, opened it up on my desk and laid out all this stuff that she was taking. A suitcase. And I said, well, just tell me the stuff you're taking every day. I don't need to know like what you took in the past. She's like, no, I take this every day. Now, and you can kind of justify reasoning behind just about all of it, but who can take all that stuff? I don't know how she was eating any food. We have to prioritize. And that's kind of what I work towards with patients is treat at the deepest level possible. And then you don't have to chase after all this other stuff, right? If your physiology is here, you've got fatigue, pain, insomnia, brain fog, anxiety, depression. You could take something for all of these, whether it's a drug or an herb, but you're chasing after symptoms, right? And not fixing the underlying cause. So let's say you were lucky enough to pick the right drug or herb, and now the symptom is better. You still haven't fixed this underlying problem, and that damage persists. So chasing after symptoms to me is like putting a little piece of tape over the check engine light in your car. We can also chase after these secondary or tertiary dysfunctions. Docs will do that, right? Hey, your immune system's off. Let's go after that. Your gut is off. Oh, you have leaky gut. They did this to me, right? You have food allergies, leaky gut, candida, malabsorption, SIBO, whatever you want to call it, right? Let's fix that. And maybe, right? You get enough behind it, you'll get it to go, but it's a whole lot easier, right, to stop suppressing those organs. Chasing after these secondary dysfunctions to me are like pushing a car that has the parking brake engaged. Get enough behind it, you'll get her to go a little bit, but you'll have to do it forever. And you still haven't fixed this underlying problem. Whole lot easier. Release that brake, shift this physiology, then you don't have to chase after all that stuff anymore. Okay, Priscilla says, it's kind of specific. How much cod liver oil do you take daily, and how do you properly take it? Cod liver oil was highlighted in the recent news. It was couple forms of cod liver oil. How's my time? I got a minute, so this might be my last question. Cod liver oil is a great question. I love cod liver oil for patients. Cod liver oil has a couple different things, and go to that. By all means, go to that the newsletter, right, which talks a lot about it. It provides all the omega-3s, very helpful, cellular healing, the whole thing. vitamin A, vitamin D. The one we use has vitamin K in it as well. I use this Royal cod liver oil, which is a fermented, naturally processed cod liver oil, one of the only ones on the market, which I love. It's one of my favorite products. 2 to 4 caps a day is typically what we'll do. Or you can do it like a teaspoon of the gel. It doesn't taste great because it's naturally processed, so it's kind of tastes like cod liver oil a little bit. But it is one of the most natural, kind of pristine products. It's a great product, nutrient dense, covers a bunch of different things. So go to that newsletter and take a look at why that's so important. Okay, so yet again, I have run out of time. We just blasted through an hour of talking about things that are and are not adrenal fatigue. My hope is that armed with that information, you can be a little better educated about what adrenal fatigue just might be, and if it just might be a piece of what you're going through. And if it is, full stop. If you find out you have adrenal fatigue, that is what you have to fix. Practitioners will say, oh, they have, I have adrenal fatigue, but I also have leaky gut, and I have ovarian hormone problems, hypothyroid, and I have immune system problems, and I also have adrenal fatigue. I'm like, no, you have adrenal fatigue, which is causing leaky gut, immune system problems, blah, blah, blah. Fix that. You fix that, and you can get your life back. It takes a little work. Takes a little education, takes a little information, takes a little time. Now, any questions, concerns, whatever, go to our, go to my YouTube channel, reach out and call us. I do have patient coordinators ready to talk to people as needed, and we'll talk to you next time. All right. All my best.